Hey friends, Jeff here with a new episode of Conversations Life Science Leaders Aren't Having. Today we welcome as a guest Pete O'Hearn. Pete is the CEO of Fibrobiologics, where they are intensely, urgently working to harness the power of fibroblasts. And as he invites you at the end of our conversation, go and research fibroblasts and the potential and the opportunity that is in harnessing the power of them in terms of treating disease. Who Pete is to me is the word inventor, not just inventor for the sake of invention and the creativity and the innovation that comes with that, but inventor with a heart and a desire to serve the patient. In everything Pete does, the patient is in mind, and he's always looking to stay close to the patient, to understand the patient. And even in his own story, things have developed for him where his empathy and connectedness to the patient has been raised to a new level. I think you're really going to enjoy this conversation with Pete O'Hearn. Pete O'Hearn, welcome to the show. I am really thrilled to welcome you and to have you as a guest today for our time together.
Well, thank you for having me. Appreciate it.
Oh, you're most welcome. So I just did a brief introduction of you and who you are to me. Would love for you to start us off and share what you're up to in the world.
Well, we are a company focused on fibroblasts. So kind of everything that you've read about and heard about stem cells over the last decade. There's two cells in the body you can use to regenerate tissue and cure chronic disease. There's a stem cell, which everybody's heard about. And then there's a fibroblast, which almost nobody's heard about. And that's the area that we're in. It appears to be a better cell source than stem cells. And they're in much greater quantities of stem cells. They actually outnumber stem cells 5,001 in the human body. So while everyone else has been chasing stem cells for the last decade, we've been chasing fibroblasts and have found them to be an exciting cell for regeneration and repair of chronic diseases.
As I've gotten to know you a little bit, mostly through cyber stalking on LinkedIn, I mean, you have a long journey in the life science space. And I'm curious at this stage in your journey, Pete, why this now? Like, what was it? I mean, you've been in this role at Fibrobiologics since March 2021. Why this and why now?
Well, actually, the ability of the fibroblast to differentiate into a different cell was brought to us by a French neurosurgeon and wife was a French dermatologist, and we've worked on other products in the past, but they were kind of an improvement over an existing technology. So when we saw this, we said, "Well, this is interesting, and if it worked, it could be a game changer." So we started in the disc space because he was a neurosurgeon. But as we proceeded with the research to determine if we could regrow the disc, I started challenging our scientists to explore other opportunities, and it was a virtual explosion of discovery after that. At one point, we were filing up to 5 patents a week. The research was overtaking our ability to even write the patents. It was really a once in a lifetime opportunity to find an area that was so untouched in biologics and to pursue it and to have so much success with some of our clinical work with these cells. So I wouldn't want to be anywhere else. And, God bless all of my brethren in stem cells. I wish them all the luck. We need cures from stem cells and fibroblasts, but our mission with fibroblasts, I think, is an important one, and it's incredibly stimulating every day.
And what I get about you, at your heart, you're an innovator, an inventor. I think I saw this statistic of over 300 patents or pending patents. And so I'm just getting that this opportunity really speaks to the heart of who you are. Is that how you describe yourself? You're an innovator, an inventor. Is that part of what makes your heart beat faster?
It does at this point in my life. I would have said early on that I was more a biology based business man. I was in hospital administration in the early part of my career. My entire family is in medicine, so I never dreamed of doing anything else other than medicine. It's what I've been passionate about my whole life. My grandfather was the first urologist in Houston. He actually brought kidney dialysis to Houston in the early 50s. So that had been ingrained in me. Was I going to predict that I would have a patent filed in my name? Never did I think that growing up. Now I think I asked the attorneys a few weeks ago, it's probably close to 400 that we have filed. So I never thought I would end up in that spot, but as we challenge the scientists and as I continue to do research in this area, the area that we can pursue for fibroblasts is virtually unlimited. It's only limited by my scientists telling me no, that won't work, and then I challenge them: can we at least try it? The inventor part of that, I think, is a surprise to me. I think I kind of always thought of myself as an innovator because we've worked on other products, but being just a organic inventor, I think is new. But I enjoy it. It's a lot of work. I'd probably stay up till midnight every night working on patents and filing of patents and answering rejections in different countries. So it's a big part of my job.
I'm curious. Is it so? Some people who might call themselves, wherever stage they're at, the inventor, it's that creative process. I'm sensing there's a more to the story about that points to impact. As we talked a little bit to prepare for this, and even learning your story about it, the story you shared about the investments you're making in Africa with school kids, I have a sense that the drive behind invention is about impact. Do I have that on, or is there something else that's driving that?
You know what? That's interesting. I haven't thought about that, but it probably is a guiding force behind that, to do something of import in your life. And medicine every day, even the small tasks are important, right? When I first got into medicine or hospital administration, I worked for a Catholic healthcare order, and one of the nuns told me one day, she said, "Don't ever forget that there's a patient at the other end of every conversation." And so I think that is, I don't know of another industry where you can impact lives as much as medicine on a daily basis. From the person working in the kitchen, to the person responsible for preventive maintenance on the equipment, to obviously the nurses and physical therapists and lab workers. I mean, it is everyone impacts those patients in the bed. And so I've tried to, when we go into this in the biologics field and we build a company, I try to impart that on our scientists and to make the scientists kind of the rock stars of our company, because at the other end of every experiment they do is a patient that needs that experiment. So yeah, I think that having an impact is important. The old saying, don't find something you love and you'll never work a day in your life. And certainly that's this. I love it. It's more of a lifestyle than it is a job.
It makes me think of this quote by John Ruskin, where he said that the highest reward of your work, I think he used the word toil, the highest reward of your work is not what you get from it, but who you become by it. And I sense there's been, for the last 25 years plus maybe, there's been a becoming process that's been unfolding. Who would you say you have become at this stage in your life?
I would like to say I'm more patient. My wife might disagree with that, but I am more patient. I think that I can absorb an almost inhuman amount of stress. So I have become that person that can take that on. And I think that what we've seen in our discoveries in the lab is that really there's still a tremendous amount of opportunity out there. When we filed our first patent, I think the number was 6 million. Now, the last one we had issued was over 10 million. So just think about that part of it, because that's the number of patents that have been issued in the US, correct? So almost you've been filing patents for 50% of the patents that have been issued. That's a pretty impactful thing to say in your life. And other people that have thought of inventions that we've partnered with on patents, who may have only received one patent, the excitement that they have in their eyes is really exciting for us. So I think that I've become a person that sees no boundaries, would love to pursue almost anything related to biologics. And it takes more than one scientist to tell me no, I guess I would say.
Mm. And what's the impact of who you've become on your team and the people who are associated with what you're doing?
Well, I think that they would say if they tell me no, they better bring a lot of research and justification, because we will go through it all and we may still end up doing the experiment. So I would say that the scientists that have worked with me would say that I challenge the status quo, challenge what we already think we know in biology, and if there's an experiment worth doing, let's go ahead and do it and see if it works. I go with the Thomas Edison version of inventing. Try everything that could possibly work and see where that takes you. I think at one point on the light bulb filament, he tried bamboo, which nobody thought would work, right? Including him. But he said, I wanted to make sure that we could tell everyone we tried every material available at the time, including bamboo. So I very much subscribe to that kind of R&D development. Try everything.
And my sense is that takes a special relationship, specifically around trust. Because the reason is I was having with one of my clients, I was interviewing as part of a project, a bunch of scientists, and they said to me, I wish they would just trust, they being senior management, I wish they would just trust with what we're saying. And in that organization, there was a trust problem. And as you're describing this interaction with your scientists and you challenging them and saying, no, let's keep going, let's try it anyway, it takes a tremendous amount of trust in that relationship for that to work, because that wouldn't work in every company or every organization. Is that true? When you think about your relationship with these scientists that you're challenging to do more, to keep trying, that it's grounded in trust?
I think so. And some of them, they've worked in a certain area and they've developed a certain philosophy on how things will turn out. And so I never push a scientist who absolutely believes that it will not work. I will not push that scientist. I will go to the scientist on the right, the scientist on the left. If both of them say this absolutely will not work, then I will look for an outside scientist, because we're not, if it's worth pursuing, it's worth getting at least the first round of data back. But I won't push our scientists. I won't just lay down the gauntlet and say, you have to do this research. I mean, they have to appreciate the process, the discovery. They have to have passion behind it. And if they do not believe, then I don't want that scientist doing the work. We can circle back, and that scientist can improve on what we already developed outside of them. But I trust them to do the work in the lab, and I trust their opinion. But if they are adamantly opposed to pursuing a certain angle of research, then I won't push them in that area.
Hmm.
I just don't think you're going to end up with a good result. I don't think you're going to end up with a scientist that's going the extra mile for that unless they have a passion for it.
And what is it about the relationship? So I hear you say you trust them. I'm wondering, what's the dynamic look like where they trust you, where they've said, Pete, not going to work, don't believe in that, and you go to the outside scientist or the one on the left or the right, where that they trust you to the point where, like, yeah, this is how I feel, but I trust what Pete's going to do next.
Well, I hope they would say that they trust that I put science at the beginning, middle, and end of everything, that our science truly guides where we are. It's much like, in the hospital business, your technicians and your nurses, I mean, they're at the heart and soul of that entire hospital. So our scientists are the heart and soul of what we do. And I would hope that if we bring something back to them, I mean, we have a project right now that I'm working on, an outside group. I hope it works. And I hope that, we're able to show them a discovery in an area that they didn't think was possible, and that it could open up their eyes for other areas and other discoveries. So I think that trust goes both ways. But if I feel strongly about a particular area, or I think that it could benefit the patients, and maybe a particular scientist has run into dead ends researching that before, that's typically how they end up with their philosophy on a certain research areas, that they've hit dead ends when they've been working at other facilities. Hopefully when we come back with the new data, if it works, that we have a convert, and a passionate convert, to pursue it.
Yeah. I want to circle back to something you said a few minutes ago. You were referring to maintenance and quality, and that everybody's part of this story. And everybody has to have the thought that at the end of this is the patient. It made me think of the story of John F. Kennedy when he was walking through Cape Canaveral after he made his declaration that we're going to put a man on the moon. And he came up to a janitor and said, what's your job? He goes, oh, I'm putting a man on the moon. It feels like that's a little bit of a lot of the culture that you're creating. What is it that, take us into the conversations, the all hands meetings or the one-on-ones? What is it that enables you to go to that maintenance person and say, hey, what are you doing? And you say, and he or she might say, well, I'm serving the patient. What is it about what you create in the culture that enables that to happen?
Well, I think you can, you can do things with your words, or you can do them with your deeds. And I think that they see over time that we don't just say that, we actually mean that. We had a internally controversial decision related to a particular science we were working on. And it was an opportunity for me to demonstrate to the scientists that we go with the science. We go with the integrity of the science. And so we made a very tough decision this week, and I think the scientists were impressed. I think they probably were a little surprised that we went in that direction, but I let their science win. And so I think you do that with your deeds, and you do it with, you don't just, if you're in the hospital business, you don't just celebrate the nurses' birthdays, you celebrate everybody's birthdays, right? So that they all feel a part of the team and how important they are. And when I was in the hospital business, I managed by walking around. I did I did work in the physical therapy area, and I was in the lab, but I was also in the kitchen every day. What are we serving for lunch? What can I do to help you guys with your job? And in maintenance, what are we doing in preventive maintenance? And when a hurricane came and hit, I sent my family to Austin, and I went into the maintenance area and put on the overalls and helped get the hospital ready for a hurricane. So you can say these things, and I think a lot of the management type people espouse a philosophy but may not act in that way. So it's really what you do with your deeds.
I love that. Yeah. The phrase, what you do speaks so loudly, I can't hear a word you're saying.
I love that. That's very true, and I hope we demonstrated that this week. I was just talking to my CSO about that, the decision that we made on that, and hopefully we'll demonstrate to them. Because when we bring a scientist in, the first thing we tell them is this is a science-driven company, and the credibility, because we're doing something that people haven't heard about. Our science has to be impeccable, irrefutable, repeatable, and we can't have any holes in our science. So when we make decisions, we want to make decisions based on that. Not that we just told you that when you got hired, but that you see it demonstrated in our decisions.
I love it. I love it. Pete, the name of the show is Conversations Life Science Leaders Aren't Having or aren't having enough of. When you hear me say that phrase, what's the first thing that comes to mind?
I've thought about this question since we had our talk. To me, what they're not talking about, or maybe they are, but we're not doing enough about it, it's really going to be affordability for cell therapy. It is so expensive right now. Some of the therapies, there was just a new therapy approved last week that's going to be in the millions of dollars for that regimen, for that particular cure. We have to get that down. We have to get the time to commercialization down, from idea to commercialization through the FDA and regulatory. We have to get that time down. One of the things that we've done in cell therapy that I think has handicapped us a bit is that we're taking one dose of cell therapy and we're saying that cured you. When we take multiple, if you're doing a prescription from your doctor, he's giving you multiple pills in a bottle. But in cell therapy, we, for some reason, have just said one dose should cure you, and that's a big burden. So we give you one dose, and we check in a year later. I think we need to accelerate those. We need to look at 3 and 6 month timelines. We need to look at multiple doses of cell therapy, and we have to find a way to bring the cost down. I think that's one of the great things about fibroblasts is they're just a much less expensive cell source than a stem cell. They're easier to harvest, easier to grow, easier to ship. Everything about them is just a less expensive option with, actually more therapeutic value that we've found. So it's going to take a lot of effort. And I know the reason why these are so expensive. It's very difficult to harvest and grow stem cells, but also the research time it takes it to get to commercialization is so expensive that you have to recoup that. And I get all that, but for these to truly make their mark, we're going to have to bring the cost down.
What are the conversations, internal or with other stakeholders, that you're having to directly tackle that?
Well, we're talking about doing multiple doses, which you can spread the costs out on each one of those. We're always talking about sense of urgency, how we can get our trials done quicker. Patient recruitment for those trials is a huge issue. How do you align with a CRO that can help in that patient recruitment areas? And we run a very lean ship. We're not bloated with bureaucracy. We don't want multiple layers between us and the lab and us and the patient. So I think all of that, you'll see us keep the cost down. Sometimes when I hear about a new company and I go look at them on the internet, I'll see 15 executives already in suite before a commercialized product. I don't think you'll see that with us.
And what challenge that you give to your people to be able to meet this desired objective of affordability, ease of access? What are the, you're having a meeting with your team. What are you saying to them to challenge them to be able to achieve what you just described around affordability and access?
I think we had the University of Chicago came into our lab to do a tour last week, and they asked one of our scientists, what is the difference between academics and, a company like Fibrobiologics? She said speed, urgency. And I think that, the faster you can get it to market, the faster you can get your experiments done, the less expensive it is. So I think that if you talk to our scientists, they would tell you that we all have a high sense of urgency.
Mm.
Even from our CFO on down. So you have a sense of urgency in every area of the company, an urgency to get the reports done on time, urgency to do that extra thing today to get your clinical study done quicker. And my entire career, when I've had people that I've worked with, when we're doing project-based work, I tell them to shave hours, shave days. If someone says they can give it to you on Thursday, ask for it on Wednesday. If you can shave 2 hours today, shave 2 hours off the day. That all accumulates at the end of the project, and you'll wish you'd done that. And speed will keep the cost down.
Yeah, speed and urgency are kind of buzzy words that it's easy to say and harder to operationalize. And you just talked about setting deadlines and those conversations and challenging people on timelines. I imagine, again, because I was in an environment of executing on projects in my previous act, and I would just sit there and like, yeah, whatever. We'll do our best. We'll do our best to get it on Wednesday instead of Thursday. And then when I got back to my desk and talked to the team, I'm like, just keep doing what you're doing. Now, granted, in that world, I was not driving the type of impact on patients that you're talking about. But it just, for me, it brings up the question of how do you make that truly operationalize this mantra of urgency?
Well, I would tell if it was an individual scientist, I would tell them, if you want to be successful in your job, and I know you do, that you will adopt it. And part of that is the screening when they come in. For example, our executives, if you are an executive applying for a position with us, and you do not have the ability to sit at your computer and create a work product, you will not be successful here. And I talk to them in terms of how you're going to be successful in your job. So our CSO and our CFO, part of the interviewing process, I realized early on, these were people that sat down and created a work product. They didn't have to hire a team of 5 people. So if I talk to our scientists and they don't have that same sense of urgency, one, we've probably missed something in the screening process when we hired them. But two, I would talk to them about, you want to be successful in your position, and you're going to have to adopt certain characteristics that will make you successful, because people around you will have that sense of urgency, and they'll be more successful. So that's how I would kind of cover it with our folks. And I think with anything, there has to be a sense of urgency. I mean, that's a critical part of business. The other thing would be, curiosity. I couldn't imagine hiring a scientist or a CSO who didn't share that same curiosity.
And throughout, we haven't used this word, but what we're talking about in some ways is the engagement, the active engagement of your employees. And I feel like engagement gets this HRE notion about it. Like, we got to make people happy. But you're not talking about making people happy and loving their jobs as the primary. That may be an outcome. You're talking about engagement of their thought process, of curiosity, of doing what needs to be done to move things along. That feels like a less soft version of the rap that employee engagement gets sometimes when we talk about that. How do you
I think so,
how do you see that?
Well, one of the areas, when you're busy, you're happy. I think one of the Most interesting statistics we had in hospital administration is when we had a high patient census, let's say we were approaching 90% occupancy, our employee satisfaction was the highest of the year. If our census dropped below 60%, employee satisfaction went down. So that tells you that people like to be busy on the mission. They have to agree with the mission. I just assume if you're in healthcare, I assume if you're a scientist in biology, that you have a passion for that. Keeping them busy, meeting the needs that they have to carry out the experiments that they're doing, giving them control over the design of those experiments. I think our CSO would probably say we give our individual scientists more control over their experiment design than any company that he's worked for. All of those things lead to that satisfaction, that impassionment that we're looking for our employees. You will not do a good job unless you're passionate about what you're doing. It's important from the finance area of our company through to the science area. It's just all critically important to us that you're passionate about what you do.
Yeah, what I'm really getting as you're describing that engagement is that this level of engagement, that the performance just naturally flows out of that. And it's not about your PTO policy. It's not about whether you have foosball tables or casual Fridays or these things, again, that sort of get lumped into this idea of engagement or employee satisfaction. The way you're describing it, Pete, it's very work-oriented. Are we busy? Do you have freedom in the work that you're doing? Can you challenge? Can you bring ideas? It feels like it's the idea of engagement is very much centered around the work itself and not those peripheral things that sometimes get talked about with satisfaction and engagement.
And are you heard? Our scientists have an open line of communication through all of senior management. And we certainly have an open door policy here. We don't want to have layers upon layers of management between us and the science. Our onboarding executive is our CFO. And so if you're a scientist and you're coming to work for us, probably the second person you see at the company outside of the CSO is the CFO. And so he gets some time in there to find out who you are, talks to you about the policies and expectations that we have here. And then when you start your role, you'll get a contact from me. And you'll get an email from me before I, probably get a chance to meet you. But that email will say, if you need anything, contact me directly if you need it. So I think that community that we want to build where we're all in together, and it gets more difficult. Every new person you bring in is a new personality that you have to tend with. And so, but if you can somehow keep a community atmosphere where you're all charging forth for the same goal, you're going to have a much, much better result. One of the areas we do is I talk about a lot is redundancy. If something happens to a particular scientist or they have an emergency in their family, is there another scientist that's familiar enough with their study that they can pick up and run with the animal trials that we're doing in that study? I mean, we need to have redundancy. We need to have overlap. That builds community as well.
I can say a lot of companies talk about, we're a family. They use family. I'm just racking my brain. I don't know that I've ever heard a CEO describe the environment the way you are, of creating community. And I would imagine there is no they and them. A lot of times you talk in the life science organization, they being the C-suite, CFO, CSO, CEO, and us and them. I imagine there is none of that talk at Fibrobiologics.
We don't see it that way at all. We don't see it as us and them. I mean, we truly see all of us on the same mission. One of the things that we do here is we ask our scientists to take a moment, put together a small presentation, and present it for everybody. About once a quarter, we have the scientists come in and they each tell the entire group, because sometimes when you're so tunnel vision into your own work, you might not be listening to what the other scientists are working on. So it gives them a moment to say all the great things they've done, gives them a moment to share ideas with them, and it creates some great encounters with the executives that we can, it kind of refreshes what we're all doing and what we're about. And we do that multiple times a year.
Hmm.
I look forward to that. I look forward to hearing our scientists come in and they do about 15-minute presentations. I look forward to that more than I look forward to probably anything else in this job.
That's good. We talked before. I asked you about who you've become. Part of your story that you shared with me earlier is a fairly recent medical diagnosis of your own. And I'm wondering, in your becoming and how you show up to the world, to your work, how has your own diagnosis and your own challenge that you have in front of you, how has that shaped who you've become as a leader?
I think anytime you're in research or anytime you're in medicine, they say doctors make the worst patients. It really brings it home when you're dealing with your own medical issue. You say, wow, now I have more compassion. I think maybe my children would say I lack empathy, but I have more compassion for what people are going through. And, we've been trying to cure chronic diseases for over 60 years with, man-made chemical compounds. I don't think it's ever going to happen. Curing a chronic disease will come through a cell therapy, immunotherapy, or a gene therapy. So when you have your own diagnosis, you say, well, we really need to hurry up, because if I'm singular, there's a lot of people out there with the same issues that we need to get in front of and cure. So we like to say that there's, the patient at the other end of every conversation, and we've got to cure those chronic diseases because they're suffering every day.
It feels like it takes empathy to just another level. In my work with teams, we call it developing radical empathy. It feels like what you just described takes your level of empathy, which you had and have had, given your history in healthcare and in life science, but it feels like it's translating your level of empathy to a whole other level. Would you say that's true?
I think so. I mean, I see the patients that we have in our trials. I get emails from them. We feel the suffering on a daily basis. And we don't ever want to be too far removed from that. We don't want to be in a bureaucracy where we can't feel that suffering. And that's what drives our research.
We're coming to the close of our conversation, Pete, and we always ask our guests one question. If we could wave a magic wand and you plant the seed in the minds of every life science CEO across the globe for one conversation they're going to have over the next week. Forget the fact that we're recording this just on the doorstep of Christmas and the New Year. So hold that to the side. But you get to plant the seed for one conversation that these CEOs are going to have over the next week. What's that one conversation?
That is a great question. I guess I would say, how far are you away from the actual patient? Where are you as an organization? And as you get bigger, layers form. It's inevitable. But what can you do to make sure that you're as close to the patient as possible? I've heard that in some large organizations that the scientists or the engineers involved have never been to a hospital or never seen a patient, and you're designing products or cures for people that you've kind of been removed from. So I would say that going back to my earliest days when I, left graduate school and went into hospital administration, that patient is the key. And that's why we're all here to cure the suffering of those patients. So if I was to say, any conversation I would have with an executive in the biotech space, it would be, how far removed are you from the patient? How can you get closer?
I love that question. Share with us what you would love us to know even more. You've shared quite a bit about fibrobiologics. What else would you love to highlight before we wrap?
Well, I would just like to say that the fibroblasts are a cell. When people see this and they may not have heard about it, go research it, because even when we talk to scientists, they're mostly from the stem cell field. They had no idea what fibroblasts can do. So I would just say that there's a similarity of fibroblasts and their capabilities with stem cells, and then there's a huge difference. We think a more positive difference. We think they're more robust and they have higher therapeutic values, higher immune modulation. So I would just say that, to leave everyone with, go look up fibroblasts. Look what they're doing. When we started this project, there was one paper a year. Now there's 2 papers a day being written about fibroblasts. So it's coming. Familiarize yourself with those, and hopefully that brings you back to us. We're the world leader in them.
Well, we're gonna in the show notes for this episode, we're gonna put your website and where folks can go and see the great work that you're doing. Pete, this has been so much fun. I'm really grateful for the time together. Thank you so much for the work that you're doing.
Thank you for having me. I appreciate it.